big data, analytics, and machine intelligence. And the 6th TYAN International Thematic Workshop. This is day 2 of the symposium. We had a nice time yesterday, especially at the workshop, the interactive workshop. Those of us who are here this morning, I want to implore us all to be there in the evening. It was a very, very exciting event for us yesterday. This morning, we are starting the symposium, as you can see in the program, with the SDG session, and Dr. Max Paholi will be speaking to us this morning. Dr. Max is the program coordinator of the World Academy of Sciences to us.
So thank you for your attention. I went slightly over 15 minutes, I'm afraid, so I apologize if that's the case. Thank you, Bolanli, again for letting this topic into your program.
Thank you, Dr. Max. I don't know if anyone has a question. Does anyone have a question for Dr. Paoli in a few minutes?
I just want to say from my side, I wholeheartedly agree with Dr. Paoli, Max. So important to educate ourselves, be more knowledgeable in helping to create that better future that we need and want. So yeah, great presentation.
Thank you so much. Thank you for listening.
Thank you. Thank you, Dr. Paoli, for that nice and exciting, very insightful presentation, where we have to tread a new path, not just business as usual. Thank you very much. We are grateful.
Thank you. Have a really good workshop. All the best.
Yes, thank you. So we'll go to the next session now. That is, the next session will be moderated by Dr. Chimusa.
Can you hear me?
Yes, we can.
So it's my pleasure to welcome all of you for this session. Let me get my screen right. So this is our theme number 3, which is based on data sciences for health-related applications. And it's my pleasure to introduce the keynote presentation. Dr. Jacques Ludik from South Africa, Cortex Logic, and you'll be talking about AI-enabled, ultra-personalized health wellness.
Thank you. Thank you very much. Can I start?
Please.
Okay. Thank you very much for the introduction. I'm just going to make that smaller. Can you see my screen?
Yes, perfectly.
Okay, fantastic. If there's time permitting, I'll do a little demo as well, just to show you what this Journey Health Wellness platform looked like. But as you rightly say, this is the focus. I believe I've got 30 minutes. We started slightly late, but I'll be quick through the main presentation, and then also leave some time for questions afterwards. So I'm going to talk about AI-enabled, ultra-personalized health wellness. Now, if you think about the world that we live in right now, if you think about what's happening with Google and Facebook and Amazon, all these kind of personalized recommendations, the opportunity that we have is to also have that for health wellness, so we can nudge people towards healthier behavior, help people to change lifestyle, all of those type of things, and use smart technology in a smart way to actually help create that better future that we want. So my massive transformative purpose is really around, and the businesses and the vehicles that I have, the Cortex and the Machine Intelligence Institute of Africa, and journey platform that we are busy with is how can we shape that better future in this smart technology era. And the smart technology era is really the fourth industrial revolution, but it's more than just the industrial revolution. It's really impacting all economies, disciplines, industries. It's even challenging ideas of what it means to be human, all of those kind of things. So we are sitting in a very, very interesting time and space. And the question is, what are we going to do? We need visionary leadership to execute on the right things. So if we look at the speed of technology change in the smart technology era, it's truly exponential. And there's also a number of different smart technologies in this toolbox that's all coming together and making an impact. And it allows us to actually create incredible solutions. You probably recently heard about AlphaFold's application in terms of protein folding as well. All these kind of breakthroughs that can potentially help structural biology and other things as well. This is the kind of things that we are seeing with AI technology. So we live in this era, and I'm not going to go too much details here because I'm going to delve more into health wellness, but I also wanted to set the scene in terms of just the broader picture. How can we use smart technology to unlock that business and societal value? And if we look at the bigger picture in terms of just business value unlocking, initially it was agriculture, fishery, metals. And then on top of that, the industrial, financial services, that's also adding opportunities to unlock value. And then from 1995 to 2019, it's pretty much the internet era that dominated and will still be dominant. It also helped create masses of data that allows us to enter almost kind of a new era with smart technology and artificial intelligence, where as we instrument the world with more IoT devices, with more people connected to the internet, with smartphones, all of these type of things, we're generating so much data that we enable AI to actually be utilized and to unlock value. So it's a fascinating time where we can use it for good. Now, very specific to us, so what we do with Cortex Logic, we've created a world-class AI engine for business, but we've taken this stuff and we've utilized this in a scalable wellness platform. And I'm going to talk more about this. The rest of the presentation is about that. But I wanted to just set the scene in terms of real-world applications of AI. And the way we've looked at things is, if you think about AI, you do get this kind of consumer-facing world on the one hand, and then the industrial world. On the consumer-facing side, it's all about how can we utilize data to create that personalized, on-demand service delivery, that engagement. And that is now possible with natural language processing, with lots of AI capabilities that's being added to the mix. But then on the industrial side, with devices, there's so much that you can do to detect process optimization, to do predictive maintenance, but then also to look at audio, video, geospatial, to unlock value from all of that. So we've just created these 4 solution categories where we can say engage is helping people and businesses working smarter at scale. Personalize is about smart personalization of customer products and services. And then enhance is about smart automation and enhancement of business processes and systems. Sense is how can we enable smart machines to sense and interpret the world around us. So those are just some of those categories. And we've created a solution that allows us to actually create a prediction engine and apply this to a large number of different types of high value problems. And I'm just going to quickly talk about that, and then we're going to delve into health wellness. So some of the applications that I'm highlighting here, and you can see I'm starting here with smart personalization or personalized recommendations for retail customers. This is where we actually use, similar to Amazon, we've created for retail customers, in this case it was 8 million loyalty scheme members, personalized recommendations. So this is possible utilizing AI data-driven approaches. Another application is where this is more for financial services sector, where we create dynamic pricing, individualized pricing for people and predicting what is optimal for home loans. So that was another example. What we also created is, and this is now part of the health wellness platform, is using AI to actually create a personalized wellness intelligent virtual assistant that can improve the wellness of medical scheme members, of employees, and that is a very nice building block of the wellness platform that I will be talking about. There's also other applications. You can see like churn prediction, or just, if you think about AI understanding the content in emails, at least the intent. So that allows us to do intelligent customer communication automation, email processing. We can alleviate fraud, waste, and abuse. One application was also around risk scoring for hospital benefit management. And you can then reduce fraud, waste, and abuse by predicting the length of stay and the cost for people that's being authorized, or say before they're authorized to go into hospital. So those are some of the applications. And then we also had some applications in the minerals, metals, mining industry. But this is just giving you a sense. What you would see here is a keyword is like the personalization that's possible. And it provides kind of that building block to take it further. So this leads me to the wellness platform. So what we've done is we've actually utilized the Cortex AI engine, which is a world-class AI and smart technology platform, to create and build opportunities to engage with users to help change behavior. And that results in improved wellness and, very important, ultra-personalized, but also privacy and choice. We got to make sure that when we deal with healthcare data or people's data, that they give consent and that there is that it's being utilized in a proper way, not being exploited, but help them to use the data for their benefit. So that's very much part of what we do here. So if you look at the broader picture here, in terms of a journey health wellness platform, so again, it starts with data. So what you see on the left-hand side is specifically the types of data that we are getting access to and that we are also creating by using this intelligent virtual assistant and app and smart platform. So every user interaction with the wellness platform, with the wellness app, allows us to understand a little bit better what people's requirements are, what their needs are, what their wellness state is, etc. We've also digitized health risk assessments, weekly checkups, wellness checkups, mental health. All of these kind of things are being digitized. So it's very easy for people to just provide that kind of information, and in real time, we do things with that. I will talk more about that. But also these days with wearables, and I'm wearing a smart watch here as well, there's incredible opportunity to get more real-time information. So it's like instrumenting people with you getting more information that's complementing the user interaction, the health risk assessment data, etc. And that gives you ideas about fitness, sleeping patterns, all of those type of things. And then we can also bring in third-party data. But then as we provide value to medical schemes, and we are engaging with medical schemes, we're also getting access to medical claims data. As we're engaging with employers and corporates, we're also getting access to employee data. So all of this data allows us to actually provide tremendous value add where you can really drive that better health wellness for the individual user. It's really all about the user. But at the same time, as you get more healthy people, you are also reducing costs and everything around from a medical scheme perspective, and exactly the same for the employer. So that's what the Journey platform, AI-enabled Journey platform allows. And so what I'm going to just quickly talk about what we do. So if you think about just the business case around this, you would see that currently there's an upward trend in terms of absenteeism. If you think about people getting sicker, there's issues, people not that productive. As a matter of fact, productivity is going lower. We see a constant increase of healthcare. So how can we disrupt this? How can we make it more cost effective for more people, healthcare in general? We also see a decrease in engagement. And this is again where smart technology can make a big impact. And we see literally a decrease in health and wellness. So basically what we want to do is use smart technology to actually reverse this trend and say, let's increase the health and wellness, the productivity, the engagement. Let's reduce absenteeism. Let's reduce the cost of healthcare. So that is really what we're driving towards. And if you think about the major problems, if you think about what we have here, there's actually, well, there's probably more than this, but there are 8 high-level risk and behaviors identified that's driving 15 of the chronic conditions. And that's accounting for 80% of the total costs for all chronic illnesses worldwide. So how can we use technology to make a difference here, to nudge people to create healthier lives? So what we do is we assist members. So this is from a medical scheme perspective, to live healthier lives. We want to change those negative lifestyle behaviors. So we've digitized. So how do we do it? We've digitized screening. So the assessment, we made it simple and easy. The moment you've done it in real time, you've got an assessment of your health risk. There's also intelligent virtual assistant that talks to you about the whole spectrum of health, mental health, fitness, diet, exercise, all of those type of things in a holistic way. So we impact lifestyle. There's also rewards associated with that, and it's all about the results. And we also have a very modular approach around that as well. So to integrate that with existing wellness programs, third-party providers, disease management programs, all of those type of things. So I'm not going to go into too much further detail here because I want to actually show you what it looks like. Do also a quick demo. So the case for medical schemes, I think we do have a major problem here. We do have an aging profile. There's increased claims. 74% of healthcare costs relate to 4 preventable diseases. So it's about the financial sustainability of these medical schemes. But also, if you think about what's happening right now, screenings is pretty low still. The uptake is low. There's no changes of behavior. So the disease programs are underutilized. So how can we actually create managed care or preventative managed care programs that's making an impact? And then on the engagement side, we've got smart technology that allows people to really engage and drive that. As we've seen with the way YouTube and recommendation engines, social media has been using, we can use it for good. And this is what we intend, what we are doing. And then on the technology side, it's obviously using smart technology to help with this engagement. So for the employer groups, you see similar type of things. It's, again, you want cost-effective healthcare. You want proper integration with benefits and programs. You want to make sure that it's not reactive, but more proactive. And you want to drive that engagement. You want to enhance the HR function and business success. And again, we use technology for that. And then for the user, it's really all about the user. So with the intelligent virtual assistant, there's a wealth of knowledge that we make available at your fingertips. So this intelligent virtual assistant that knows about your specific wellness state, but it also has got libraries and knowledge bases of information that we source from the best sources that we've got available in the world right now to provide that information to the user. It's really about educating people around this, better lifestyle and so forth. And then again, we can integrate that with benefits and programs. It's all about better health and creating that. So what I want to do next is just to give you a sense of what it looks like. And I'm actually going to do a live demo. I'll show you quickly on my phone what it looks like, but also on a web page. What I'm also just going to show is the last number of slides here is we've tried to make things simple. So if you think about a use case, you want to drive wellness for a user with diabetes, hypertension, anxiety. So you want to make it super easy for them to log on. And then very simple and easy to capture personalized health and wellness data via this digitized health risk assessment. And the moment you fill it in, you've seeded the system and there's immediate analysis. And I will show you what it looks like. It gives you a real-time dashboard of your wellness and health risk. Then there's the opportunity to interact with the coach, the wellness coach, and there's also very specific advice and coaching and guidance, push notifications. There's an advice dashboard providing you with very specific advice. It's like, be careful, your blood pressure results are elevated, or if you feel stressed, whatever, feel more relaxed, do this, da da da. So it provides you with those type of things as well. And then anonymized, we provide medical schemes and employer groups with holistic analysis, so you can see if people are in general, if members are in general getting healthier. You can do this overall health risk assessment, and that's obviously helping to reduce costs and have a better understanding of what's happening with medical scheme members, what's happening with employees, etc. And what we also have is these kind of modules that's more focused on specific chronic lifestyle diseases like diabetic care plan, mental health, HIV, all these type of things. So there's a whole thing around diabetic care plan. And I'm not going to show, I'm actually going to show a little bit, I'll just quickly go through this and then I'll show the platform as well. So the Journey Wellness platform, which was recently launched. We're rolling this out with some medical schemes now. It is available by going to the Journey Wellness .co.za website, but there's also an Android and iOS mobile app that you can install from the Google Play Store and Apple Play Store. So it's just really search for Journey Wellness and you get access to the app. So that's the iOS. And then you just go through a registration process where you log in. And the first thing you do, as I've mentioned, is to actually, the HRA is the health risk assessment. And there's a number of assessments that we have, but when you click Start Survey, it will immediately pop up a health risk assessment that you can quickly fill in. It takes a few minutes. This could also be facilitated by a nurse if you want to do clinical measurements, or a doctor, or you can just go to a pharmacy and you can get some measurements. The rest of it is just quick questions that you answer. Simple as that. So it's very, very simple and quick. We also have these kind of weekly checkups to get more up-to-date information about your wellness state. So what we do, the moment you've done that, so I'm showing here, this is like the Apple and Android website. It comes up with a wellness score and shows the average wellness score, but this is based on 5 indices, and I'm going to show a bit more about the details around that. But immediately you get a view of your wellness state and assessments. And we're using some international standards around things like this, and I will talk more about that now. The dashboard also provides chronic conditions, lifestyle risk factors. You can also look at your wellness state over time, how it's improving or worsening, and what you need to do. There's also a dashboard where it's looking at rewards. So you can see a little bit more about how you're actually engaging with the system and how your wellness is actually improving. And then there's very specific advice, and there's push notifications. So for instance, if there's cholesterol advice, consult your GP to get a full lipogram. So it gives more detail there. Meals per day, it tells you it's not ideal, limiting salt intake, etc. And then there's the coach, where it's very personalized, and I'll show you a demo of how that works. So you can access that here as well. So it's all very easy to access, and they really made it simple. And then there's also goals and preferences, where you can actually define your own goals, or you can specify your diet type, your eating goals, exercise goals, and mental health goals, and so forth. Okay, so there's a bunch of links, and what I will do now is to very quickly show you actually what it looks like on the phone as well as on the web. But there's also these kind of links that I will make that is available. It's obviously in the presentation, so one can access this as well. So this is what I wanted to do as a start. I'm going to quickly switch over to the Journey Wellness, so you can see what's going on there. But I'm also going to show you very quickly what it looks like. So let's just put that maybe there, and this one here. So what I have here, if I just quickly, let's just quickly show this as a starting point. I've mentioned that you start with these kind of, the moment you've logged on. So if I log out, you will see, let me just log out, you see the Journey platform, and I'm going to quickly log on. And the moment you log on, okay, this is an administrator view as well. And what it does is actually also provide you with You can actually look at very specific schemes or genders or age groups, and you can look at BMI, blood pressure for a group of people in an anonymized way. You can look at lifestyle risk factors and so forth. So this is just more kind of a administrative view, so you can get insights. There's user tools, there's healthcare tools, all sorts of stuff, but let's just focus on the user. So this particular guy, John Smith, you can see his overall wellness. So in blue it says this guy's got medium wellness, and you can also see its average over time. And it's built up, so obviously there's descriptions of what that is. It's a combination of data that the Journey platform has collected about you, and it's been treated as an overall indicator of your health, and it's rated out of 10. The higher your wellness score, the better. But then there's 5 indices that's building up this wellness score. There's a morbidity index, there's a lifestyle index, there's a diet index, there's a mental health index, and there's a heart health index. The heart health makes use of Framingham scores, so we utilize that to actually create the score out of 10. The mental health is using, for instance, PHQ-9. It's using also general anxiety disorder. PHQ-9 is looking at depression. And we get a kind of assessment of that. But we're also looking at your diet, your lifestyle, morbidity, and things like your clinical measurements, like your BMI, glucose. You can see this particular guy, John Smith, is not very healthy. And you can get a quick assessment, real-time view of that. And you can see we also list the chronic conditions, diagnosed, unmanaged, at risk, hypercholesterolemia, cardiac disease. You can see if it's diagnosed, unmanaged. And then we also indicate the lifestyle risk factors, too few meals per day, insufficient fruit, vegetable intake, etc. And then based on this, obviously we capture this over time, so you can actually see your wellness score and if your wellness are improving or not. And for each of these indices, we also provide information around that. And you can also look at your cholesterol and glucose and blood pressure and those type of things over time. And then there's also rewards based on your engagement, your weekly wellness, and if you connect with wearables. And that drops into a points journal, so you can see how things change over time. But what I want to show you also is the advice dashboard. So here you see a bunch of red ones, which is say you have to pay attention, your blood pressure is too high, the cholesterol is a problem for this particular guy, also glucose, and then it's getting some medium, also important advice, but it's giving you on BMI, meals per day, etc. And then if it's good, keep it up. So this particular guy is still sleeping fine, not smoking, etc. But what we do is there's actually push notifications coming through, like with WhatsApp, you actually see new advice popping through. But it all starts with these kind of surveys. So if you do a HRA, if I start, for instance, the HRA, a health risk assessment, what it does is to capture specific details about you. And this is the things that you fill in. The moment you fill that in, it provides you with that real-time analysis. You can do a weekly checkup, clinical measurement checkups. There's also provision for HIV, TB, if you do these kind of vaccines or you do tests. All of these type of things are catered for, so you can actually bring that into the mix. And you can look at your settings as well. So what's your goals and preferences? If you want to change your preferences, if you want push notifications, you can do that. And then there's the coach. The coach is quite important because the coach is actually, you can see this particular instance, it said, "Good morning, John. I think started early. I see you complete your HRA recently. I've noticed your wellness index is on the low side. Your BMI puts you in the obese category and your glucose levels are elevated. I think we should chat about one of these topics." And then you can go into details here. Here I've asked, what is my BMI? It says, oh, your BMI is 30.9. So it knows about this. And it then talks about advice. And then you can go into various things. If I want to go into lifestyle exercise, I can type things here, I can speak to it, and it engages with me around these kind of things. And then it gives you information. Here it's tapping into the knowledge bases around these kind of things, and it can talk about various detailed things, chronic lifestyle diseases, etc. We also have this available. So just quickly showing what it looks like on the phone. So here again, this is my my overall view. You can see here the coach. So this is my personal one. So here I'm actually engaging. It says, good morning, Jacques. Last time we talked about health, and now I can go into healthy eating or mental wellness, and one can talk about these various things. So it's giving me information around that. But I can also go to my dashboard, which looks slightly better than John Smith's one, but you can see well, much better actually. But again, you can see the various things here as well. Diet index, morbidity index, it gives information around that, the BMI, glucose, cholesterol, blood pressure, and I've got no chronic conditions or lifestyle risk factors. I can also look at over time, my wellness scores, and also measurements and so forth. Also go to rewards and see what's the status there. Again, with my advice. So actually it's giving me positive. I don't see any red or orange, and I'm getting all of that. So that is all good. Okay, so this is just, I wanted to give you kind of an overview of what it looks like. And I think at this particular point in time, I would like to just go over to questions and answers. So thank you very much for your time. Is there any questions, answers? Or questions?
I think people did not hear me, so I was asking for the questions for.
There's possibly in the chat.
In chat.
I have a question.
Yes.
Go ahead, please.
Yes, thank you, Dr. Ludik, for this very practical application. My question is, the moment the user logs in, does it mean the user has to enter those parameters of ease on a regular basis? Maybe
yes,
weekly before I think the system, the app, the application, what it does is it does a kind of periodic evaluation before it can draw all those graphs that we see and then make those advice. So does it mean the user has to enter each of the details like the BMI, the weight, and so on? Does he need to enter the details each time he logs in, or
no?
How does the
so that's a great question, Bolanli. I think the great thing about this is you just need to enter it once, and then if you make any small little update in anything, say your BMI calculates that anyway automatically, so you don't need to calculate that. It calculates framing and score. So, but if you see there's a slight change in your weight, for instance, then immediately everything is updated. The indices is updated, your wellness scores are updated in real time. So if you've got wearables or you're connecting to devices and stuff, it just updates things based on that. And it's ongoing all the time. So it tries to keep a real-time view of your wellness, to total wellness state. You don't need to enter anything again. So it's just updating all the time. It will actually nudge you. It will tell you, oh, you haven't done your weekly checkup, or you haven't, you're not engaging with the coach, or whatever, things like that. And remember, every time you ask questions for the coach, you say, I don't feel that well, or whatever, it looks at that data information and utilize that also in the wellness overall assessment as well. So it picks up on all those little things, like your surveys that you do, checkups, the wearables, and some of the things you don't need to do anything. It's almost like my Apple Watch, where I'm just walking and it's assembling, getting all this data about fitness and health and standing and all of those type of things. So we just integrate it into those kind of systems. If you think about medical claims data, if you put claims and you don't need to fill in anything, we just integrate into those systems. We pick up that there is activity around medicine or claims or specific things from that perspective. So we're trying to reduce what the user has to do, but obviously there still needs to be that engagement, interaction. So we try to make it as simple as possible to engage with the user.
Thank you,
Jacques. Just a quick question for curiosity. So, you are aware about this kind of polygyny risk score where they actually look on using AI to actually look on the genetic side and look the polygyny risk score for breast cancer, for many other diseases. Is also, you guys, you look on those aspects as well?
Sorry, I just want to make sure I've got your question 100%. So are you saying, okay, can you just say the last sentence again? Apologies there.
I was talking about polygenic risk score, where
the risk, actually yes,
risk assessment on the genetic or DNA
data. Yes, so very important. Yes, I got it. So we actually, within the Cortex group, we've invested quite a bit on genomics and health as well. And the plan is on the roadmap to bring that also into the mix. So we've just started with a base level, foundational level around this. We want to get access to as much data that will provide information about your true wellness state. So we've worked on genomics and your microbiome and all sorts of different things as well, but those are things that we will add later on to this platform because it's clearly also an important source of information as well. So a great question and definitely something that we envisage bringing into the mix.
Dr. Jacques.
Yes.
Thank you for a very beautiful presentation. My name is Colette. Very interesting. I just want to find out if you used, in terms of tracking, let's say the lifestyle habits of an individual, yes, things like their ID. I'm going to the aspect of where someone uses their credit card or their bank card to buy food. How practical that will be if you compare in developed and developing countries, whereas in the developing countries, if I have to buy food, I buy for more than 20 people using my card, but that is likely to reflect on my lifestyle. Whereas in the developed world, it's more accurate that you're actually buying for yourself. How do we then sort things like that? But very beautiful presentation that you're giving. Thank you.
Okay, my pleasure. Yeah, so this is interesting. We obviously it's personalized. If you've got members in your family and other people, it's really focused on your ID, your specific details. In the future, what we plan to do is to also connect to healthcare workplaces, marketplaces, where you can, if you want to buy medicine or do things like that, that we can make recommendations and assist with that. But I hear your point in terms of if you buy on behalf of other people as well, how do you make sure that it is only relevant to this particular individual, if you think about lifestyle specifically. So all our information that we gather is really on a personalized level. It's more focused on your survey. If your spouse or if you've got children or whatever, they've got their own dashboards and own survey. So, and we're not, and they can log in with their own ID and own details. So we're trying to make it as simple as possible for any user to access it, very intuitive. And it's all about bringing the cost down, enabling people to have access about information about their wellness and so forth.
Thank you.
Any other questions? Well, what is the full, I see there's some questions here that was earlier on, what's the full meaning of journey? It is, I think it's just about your wellness state and it's about your wellness journey that you're on. So it's really all about driving your, it's about your improved wellness. It's making sure that technology and data is being used to your benefit. And I see there's another question I would like to about data warehouse. Yeah, so we're obviously storing data centrally, privacy, all of that is key to the whole thing we do. If there's more detailed questions, please feel free to follow up with me. I'll address those as well. So yeah, thanks.
Maybe I can jump in with the last question. Sorry, yes. Dr. Jacques. It's very fascinating that going forward for an individual, the health, medical schemes and all that follow you up and give you advice on how to look carefully at your health and reduce costs. Can you comment on whether the health authority, the medical schemes can have access to your data previously before you join them, when you want to join them? And because then that becomes an issue in their decision on how they are going to either price you or accept you on their scheme, depending on the data and what they are seeing.
Absolutely.
Can you comment on that, the ethics of
that's an excellent question as well. So my mission in terms of what I'm trying to do is we need to put the user in control. It's their data. And there was even court cases here in South Africa where I think it was Discovery Liberty, where it was concluded it's the user's data. So Discovery had to make that available, data available to the user for other purposes as well. So the way this works is when I showed you the dashboard as well, it's anonymized data. So they can't just go into individual, they can get an overall assessment. The whole thing is that's why we said ultra personalized privacy is important, so that you've got access and you can say which healthcare professionals should have access to the data. So you've got a nurse or you've got a GP or someone where this information is so useful. If you've got even that scenario, you want to give that permission to that individual to actually have access to maybe just the high level parts of it. So it's really geared towards the individual because in effect, it's about that. What are we trying to do here? It's not trying to optimize. Well, obviously, if you've got healthier people, the medical schemes will benefit, the employers will benefit. But for us, it's not about just that. It's about everyone. It's about blue collar workers. It's about most people don't have medical schemes. Most people, maybe it's informal work. How do we disrupt this whole market where you actually empower people to improve their own wellness, provide them with the knowledge? So this is kind of a vehicle, a conduit for knowledge, but as well as your wellness, just your data and stuff. But it's one source where you can actually access the data. But great question. Okay, there's another question here. Very interesting. Okay, can you comment on the validation procedure of the system? Yeah, so there's multiple levels here. So we've got, if you think about health risk assessment, so first of all, we are using international standards in terms of how scores are being, and it's just information provided. So we also say that we're not a doctor, there's managed care solutions that we also do, but then there's managed care licenses around that as well, if we offer those kind of things. But in terms of validating data, so we're obviously making sure that the data makes sense. We can validate. If say for instance, you are providing information about your BMI, cholesterol, whatever, and your wearable information is not saying a different story, we will try to find out what's the truth here, just for your own benefit. So there's validation on that kind of level that's happening as well. We can also pick up, I've mentioned also the risk assessments as well. So that's based on national standards, like say depression. If we provide something about mental health, just in terms of those specific questions that we've asked, there's some validation in terms of that, making sure that the scores and the advice that's coming with that is linked to what is being prescribed as well. So exactly the same for Framingham, the heart health. The rest of it is more like diet, nutritional stuff, exercise, which is there's lots of different opinions on that, but we've got some international standards there as well. So there's validation on various levels. We try to make it simple and keep it simple as well. Yes, I can make the slides available. So I'll create a link already, and I'll do that. Okay. Any more questions? Thank you very much.